Hello, my name is Cassie Fuller. I am a nurse practitioner student for Texas State University, and I'm going to be doing my physical assessment on my patient. The patient is oriented to person, place, and time, and I have done his vital signs.
Come in.
Hello, my name is Cassie Fuller. I'm going to be doing your physical assessment today. Is that okay with you?
Yeah, that's okay. Thank you.
Okay. Well, first I'm going to start by looking at his fingers. I am checking his fingernails. I'm assessing his capillary refill, and I am noticing that there is no clubbing. His temperature is warm. His skin is soft. There are no lumps, lesions, or masses as I work my way up his arm. The next thing I'm going to do is I'm going to check the brachial pulse. And I have a good 2+ pulse. I'm sorry, the radial pulse and then the brachial pulse. And another 2+ pulse noted. The next thing I'm going to have you do is put your hands on your knees and rotate your hands quickly. Good. And then bring your hands up, bring them down, rotate them in, rotate them out, spread your fingers, and then resist me closing your fingers. Good. Now I want you to take your thumb to each finger like this. Very good. And then I want you to press against my hand. Good. And backwards. And the same with this one. And back. Nope. Back. Good. And now grab my hands. Perfect. So the muscle strength in his fingers and hands are good. Next, I want you to put your arms out like this, and then you're going to close your eyes and bring your pointer finger into your nose. Good. And the other one. Good. Okay. Now you can relax. The next thing that you're going to do is you're going to curl your arms up like this. I'm checking for his range of motion in his elbows. Go out, rotate them in, rotate them out. And then you're going to bring your arms up over your head, behind your neck, behind your back. Good. Now I want you to bring your shoulders up and resist me pushing down. And that's checking for cranial nerve number 11. Now push your chin against my hand. Good. All right. So now I'm going to check his reflexes in his biceps, his triceps, and put some pressure and check it there, and then back here. Okay, and then I'm going to do his patellar. Whoop. Oh, you can't see me. Okay. The next thing that we're going to do is going to look at your head. I want you to put your head down for me. I'm inspecting the head to make sure there's no nodules, no lesions, no bumps, no balding, no lice, and there's good symmetry of the cranium. Head up. And I'm going to work my way down. I'm going to check his sinuses. Any tenderness?
No.
Any tenderness there?
No.
I'm going to percuss him. Any tenderness?
No.
Good. Now I want you to frown. And then I want you to puff your cheeks out. And that's showing me that cranial nerve number 7 is intact. Now we're going to check with a sharp and a soft object. This is the 3 divisions of trigeminal. So this is sharp, here, here, and this is soft. When I touch you, say sharp or soft, and this is going to show us that your cranial nerve number 5 is intact. So close your eyes.
Sharp. Soft. Sharp. Soft. Soft. Sharp.
Okay, good. Now the next thing that I'm going to do is I'm going to auscultate his temporal. Good, and there's no bruise. Very good. Now I'm going to look at the eyes. So look straight at me. You want to check that the eyes are symmetrical. They are. There's no inflammation. You notice that the eyelid comes to the very top of the iris, that the eyelashes curve out symmetrically, that there's no edema, no masses, and you check the lacrimal ducts right here in the corner. Next, I'm going to open up the eye, and I'm looking, the conjunctiva is white. The vessels are small, and rotate your eyes to look to the right, this way, and to the left. Good, and small vessels noted. It's nice and pink, and the eyes look good. Okay, so now we're going to check with my light. The corneal light reflex. At this time, I would darken the room if I was doing the exam. So I'm going to bring this light all the way into your nose. I want you to follow the light, follow this pin all the way to your nose. That's going to show us accommodation if the pupils constrict as it comes in. Good. And then to check the direct response, you would take your pin light, shine it into the pupil, and see that the pupil constricts and then it dilates as the light is pulled away. Good. And then the consensual response is that the other eye dilates and constricts bilaterally with the eye that is being tested. Next, I'm going to grab my ophthalmoscope, and I am going to check the red light reflex. So I would look through the ophthalmoscope, and you would be looking for the red light reflex. The optic disc has sharp margins, and the vessels look normal. Okay, so now we're going to check for your 6 cardinal fields. This assesses your 3, 4, and 6 cranial nerves. So I want you to look forward at me and follow me just with your eyes. I hope I'm in the picture. Okay, so you're going to go up here. Nope, just with your eyes. Very good. So we just demonstrated that those cranial nerves are intact. The next thing that I'm going to do is I'm going to look at the nose. You see that the nose is midline. There's no obvious masses, no deviation. So I'm going to take my scope here, get the light on. I'm going to look up the nose, and you can see that the nares are patent. There's no nodules. The turbinate is pink, and there's no deviated septum. Next, I'm going to check for patency of the nostrils. This will show us that cranial nerve number 1 is intact. So if you'll take your nose and cover up one side, breathe. Okay, good, and breathe. Very good. Okay, the next thing that I'm going to do is I'm going to look at your ears. First, we're going to do what's called a whisper test. So if you will take and cover your left ear, I'm going to say 3, let's see, I don't know if this camera can see me. Well, I'm going to come back here, and I'm going to say 3 letters and 3 numbers, and I want you to tell me what you hear.
A. 1. 3. C. B. 2,
And then I'll repeat it on the other side.
1, 2, 3, A, B, C.
Good. And that is showing us that cranial nerve number 8 is intact. The next thing I'm going to do is I'm going to use the tuning fork, and I'm going to activate it. And this is the Weber test to see if there's symmetry on equal sides of the ear. So the patient would tell you that they hear the vibration equally, and that one side doesn't go away before the next. Now I'm going to palpate the ears. The pinna is soft, symmetrical, there's no lesions. Any tenderness? No tenderness. Next, I'm going to look in the ear. So on an adult, you pull up on the pinna. On a child, you pull down on the pinna. So I'm going to pull it up. I'm looking in the ear. So I'm looking at the eardrum. It's nice and gray. It's not retracted. It's not bulging. You see a positive red reflex at the bottom. The ear canal has normal hair and wax. It's pink. There's no inflammation noted. Okay, so the next thing I'm going to do is look at your mouth. And let me grab my little tongue blade here. So if you can open your mouth, just let your tongue rest normally. And if you can see, if the tongue rests against the teeth without protruding, it shows you that cranial nerve number 12 is intact. Next, I'm going to look at the cheeks and the gums and the teeth. There's no missing teeth, no dentures. The skin is moist, it's pink, no lesions. I'm going to pull down on the lip to check his gums. Everything looks good. I would obviously have gloves on. Now I'm going to ask the patient to open his mouth, stick out your tongue, say ah. So when you do that, you are having the patient demonstrate that cranial nerve number 9 and number 10 are intact. Number 10 is you expect to see the uvula go up midline, and number 9 is the gag reflex. Okay, so now I need you to take your take your tongue to the top of your mouth. Nope, and we can see that the frenulum is intact. And I want you to take your tongue to either cheek. Good. And that's just showing us the strength of his tongue. Now I need you to swallow. And you just observe the swallow and make sure that it's midline. And now I'm going to test for TMJ. I want you to open your jaw and close and open and close. No popping and no abnormal movements seen. One more thing, open up big, stick out your tongue. Assessing the tonsils. I would be doing this with my light. So you say ah. Looking at the tonsils, this particular patient does not have any tonsils, but there's no erythema, there's no redness other than just the pink membranes. Okay, now I'm going to go to the back side. I'm going to check his thyroid, and I slide my fingers up in a milking motion and swallow. And then I'm going to tilt the patient's head to one side. I'm going to deviate it. I'm going to feel for the nodules and swallow. And then the other way and swallow. Very good. Now I'm going to finish looking at the neck. You're looking for swelling, for asymmetry, for any vascular dilation, any jugular vein distension. Relax, there you go. And then I'm going to palpate his notes. So first, I'm going to palpate the preauricular and the tonsillary and the submandibular and the submental, the postauricular, the occipital, the postcervical, and the supraclavicular. Good. Next thing I'm going to do is I'm going to auscultate the carotid arteries. And there are no bruits heard. Next, I'm going to check the range of motion, so I want you to take your head side, side, then back, then forward. Any pain?
No pain.
No. Okay, so good range of motion. Now I will assess the patient's lungs in the back. So first, I'm just inspecting the back. There's no lesions, no moles, if I saw any abnormal moles, I would grade them with the A, B, C, D, E pattern, or rate them, explain them. So there's equal expansion, equal symmetry of the lungs. So now I'm going to check for turgor of the skin. The patient has good turgor. You do that just by pinching the skin. I don't see any retractions, no dyspnea, and no barrel chesting noted. Okay, so now I'm going to check for fremitus. So I need you to say 1-1 as I move my hand.
1-1, 1-1, 1-1, 1-1, 1-1, 1-1.
And as I check for fremitus, it decreases as I get to the base, and that's because I have noted where the diaphragm is. Next, I'm going to percuss. And I'm going in a side downward position. And then I'm going to check for CVA tenderness, which if my patient had kidney problems like I wrote up in my health history, then you would expect to find some tenderness here. All right, now I'm going to auscultate the lung fields. Deep breath. And I'm going in a side down pattern. And I'm going to listen in 6 locations. And last one. So good vesicular lung sounds in the posterior lungs. Next, I'm going to listen down the sides in 5 different locations. And last one. Very good. Also good, normal breath sounds heard. Now I'm going to palpate the axillary nodes. Lift up your arm a little bit. Very good. And now I'm going to come to the front. First, I'm just going to observe the patient while he's at rest. I'm going to count his respiratory rate. You should expect it to be between 12 and 18 breaths a minute. The patient has good expansion, no retractions, no accessory muscles used, no dyspnea. The patient looks to be breathing with ease. So then I'm going to do the same thing on the front. I'm going to check for fremitus. So if you can say 1-1 again.
1-1, 1-1, 1-1, 1-1, 1-1, 1-1.
And as I'm palpating, I'm checking for any nodes or lesions, any lumps, bumps, and the patient has no problems You also would expect to have increased spermatus on the right upper lung field and decreased spermatus over the heart. Next, I'm going to listen in 4 different locations on the front. Deep breath. Very good. Good normal breath sounds, no crackles, no rhonchi, no wheezing. Okay, now I'm going to have you lay down. Go ahead and put your knees at rest. There we go. And put your arms down and just relax. So as I lay down the patient, I'm just going to inspect them. Look, I'm going to look for the precordium, and I want to see no pulsations and no heaves, which I don't. Then I'm going to palpate, and you should be about the 5th intercostal space, mid-clavicular line is where you're going to feel it. And then I'm going to auscultate the aorta for a full minute. I'm going to auscultate the apical pulse for a full minute. And because we're doing this for time, we're going to call that a minute. So the patient has a normal rhythm, and I hear the S1 louder than the S2. Now what I'm going to do is I'm going to listen to each area of the heart. So first I'm going to listen with my diaphragm. So my first heart sound that I am listening for is the apical. It is the 2nd intercostal space, right sternal border. The second sound is my pulmonic, 2nd intercostal space, left sternal border. My third is my Erb's point, 3rd intercostal space. My next is my tricuspid, 4th intercostal space. And my 5th is my mitral valve. Now I'm going to listen to the same locations with my bell. I'm also going to be listening to the descending aorta and my renal arteries. No bruits heard. And then I would slide my stethoscope and listen to the femoral artery. No bruits heard. Now I'm just going to listen for bowel sounds in 4 different locations. Then I'm going to percuss, and you expect to hear tympani. And then I'm going to do light palpation. Any tenderness?
No.
Okay. No guarding, no rigid belly, no tenderness noted. Then I'm going to go back and do a little bit deeper palpation. Any tenderness?
No.
Good. Now I'm going to ask the patient to take a big deep breath and relax. And I'm looking for the border of the liver. As I push deep, the liver edges are firm. And then I'm going to palpate over here. and I'm looking for the spleen. Okay, so now I'm going to move down and I'm going to check for the iliac, the inguinal nodes right here. And I'm going to move down the leg. I notice that there's good hair distribution, no scars noted, no swelling. I'm checking the patient's shins for pretibial edema. And then I'm going to check the pulses on the top of the foot. And on the outside of the foot for the posterior tibial pulses, and these are +2. Both of them are normal. Next, I'm going to have you sit up like you're doing a crunch, just a little bit. Here you go. And I'm just making sure that there's no herniation or distension. Okay, so now to check for range of motion for the hips, I'm going to bring the leg out and in, and I'm going to rotate it out and in. Any pain?
No pain.
Okay, I'm going to bring the knee up and the knee out. Okay, and pull down. Good, and push against. Good. I'm going to do that on the opposite side. Out, in, up. Okay, push. No, push up. Push up. There you go. And curl down. Good. Okay, now I'm going to check the, so good range of motion in the hips and the knees. I'm going to check the ankles. So I'm going to rotate the ankles and push your ankle in and out and forward towards your nose. Point them. There you go. Same thing on this side. Out, in, point. Okay. And since I have my patient here, I'm going to check the Babinski reflex. Okay. Now I'm going to ask the patient to sit back up. I already checked the pulses, or the reflexes, but it was kind of hard for you to see, so I'm going to scoot down here. Check the reflex. So both the patellar and the Achilles reflex are 2+. Okay, now I'm going to have the patient stand up. Let's see, I got to rotate this camera. Okay, come right here. Start right here. Turn. Okay, so I want you to put your feet together, and I'm checking to make sure that the patient has good curvature of the cervical, thoracic, and lumbar spine. Now I want you to close your eyes, and if the patient stays steady and doesn't fall, then it shows me a negative Romberg sign. Okay, now put your hands over your head and bend down slowly. So I'm looking for no inequality of the scapulas, the iliac crest, and the gluteal folds. Okay, stand up. Now I need you to walk forward in a normal walk. The patient has a good gait. Okay, turn around. Stop right there. Now you're going to come back heel to toe. Good. And the patient has good stability. And now you're going to walk on your heels and on your tiptoes. Very good. Well, thank you. You are healthy. You pass. Thank you very much. All right, thank you.